We're going to spend some time at some breakout sessions, and this will be breakout 1, station 1, 2, 3, and 4. And the questions are as follows, and you can choose 2 questions and to go to, so you're not going to be able to go to every single station. We're going to do 2 rounds. I'll go through the questions, and then you can pick where you really would like to contribute your thoughts to. The first question is medical and healthcare organizations today face unprecedented strategic, financial, operational, and clinical challenges. How would you present the business case for making patient-centered care and communication training a top strategic priority, and what pushback might you expect? Question 2. What are the greatest obstacles to the adoption of patient-centered care and communication models? How might these challenges be overcome? Question 3, or station 3, what are your best ideas and strategies for improving communication in medical and healthcare? What models, solutions, training techniques, or tools have you seen be successful? So this is to take what we've already done and to get ideas to branch things that you may have come across that have been effective to really share, to see where we can take the work further. It's really a chance to let your mind be innovative and share that. And then station 4, question 4, is primarily aimed at the faculty who have been trained in teaching the communication and healthcare across Northeast Florida. So if you're not faculty, I would probably try to avoid going to station 4. But this is to really get their collective wisdom of their experience in terms of changing the culture. So how we'll do this is choose a question, your first question that you'd like to have your voice heard and participate in, and go to that station. And we'll have a discussion there. It'll be facilitated by the teams. We'll get your collective thoughts. We'll pull them together. After 15 minutes, we're going to have you go and choose one additional question to share your comments. And then we're going to pull together and have a debrief on what we learned at all 4 of the stations. Is that clear? So right now, choose which question you want to start at. Take yourself there.
Dr. Maples?
Yeah.
We have questions on paper for everyone, so you don't have to refer back to the slides. We'll have questions at each station.
Right. So the questions are written there. They're on paper. You'll have them there. Don't worry about memorizing what is question 1, 2, 3, 4, but pick one. Let's move to the stations, and I'll let you know when the 15 minutes is up. If you, by chance, didn't have a chance to visit a station, and you do have any burning thoughts you want to add, now's the time to add them to this. Everybody with us? Okay. Question 1. Dr. Maggiera will summarize themes. Again, the question is, medical and healthcare organizations today face unprecedented strategic, financial, operational, clinical challenges. How would you present the business case for making patient-centered care and communication a top strategic priority? What pushback might you expect? So again, listen intently. If you have anything to add, now's the time to raise your hand after the debrief and add it. Holly.
Yes, I think we all agree that patient care is our most important goal, but we, in reality, are measured and paid based on different numbers. So the reality is if you give better patient care, 1, you'll get better numbers, you'll have better HCAP scores, you'll have happier patients, less lawsuits, you'll get more business retention, you'll get better outcomes. Additionally, if you have better staff communication, you'll make a happier work environment, and that will help you retain the best staff and give the best care. That communication is key for that culture that's patient-centered, and it really automatically almost improves the financial aspects. You don't really even have to think about them. It should come automatically. We did not talk a lot about pushback, but some of the pushback could be that this takes time, I'm already good at it. I think, as we pointed out, every time we've given this course, one of the questions is, how do you rate yourself as a communicator? It's always a 5. How do you rate your partners? 3. So people aren't as good as communicating as they think, and when they see that data, that often changes their mind, and once you start using the pearls, you really do see how it changes things. And again, I think that translates ultimately into financial gains for an institution.
Okay. And so how, for those of you that are in different leadership positions in your organization, how easy do you think it is to sell, I'll use the word sell, this whole concept that you will have improved patient experience, you will have better HCAPs, you'll get reimbursed, we heard some other regulatory things. How is that going for everybody? Are people really believing that, or is this a bigger challenge than it seems to be on paper? Anybody have any? Because that is the pushback part of it. Does anybody get pushback in their leadership teams?
I had the probable advantage. The CEO at Nemours a few years ago had announced that for 2015 our goal was to be in the top 5% of children's healthcare institutions in certain patient satisfaction things. So the biggest argument was this is in support of this leadership goal. So that helped. So that made it, at the macro level, an easier sell. At the micro level of, damn it, I don't have time. And besides that, you know I'm great at this anyway. That didn't change anything. The other thing that is very hard, and one of our people brought up, is it's very hard to get anything close to real-time feedback from your patients as to how you're doing in a way that's really acceptable. So, we use Press Ganey, everybody uses whatever they use. We have probably all sat through 1 million discussions about this is not statistically valid, and the sample size isn't large enough, and. So yeah, that's all true, but we're still going to use it. And these things are not foolproof tools, but they are the best thing we've got. So I think that's a real gap, that we would do better if we could put people through the course, they changed their behavior, and they got rapid and acceptable and accurate feedback that it is helping.
So this question was really to get your input, but it's also to give you something to take back, because each of you have a responsibility. If you really believe and hear what Dr. Leonard shared with us this morning, if you really hear and believe what the panel said about the importance of this work and what it does to really change that culture, you're going to have an elevator speech. You're going to have something to really make the business case so that you can have the discussions with your leadership. And how you have those is going to be, incredibly important. So this was not just an exercise to just gather some thoughts. This is meant to really have you take something back and frame your own conversations, because each of you have the power of really planting seeds in all of your different organizations. So thanks, Holly, and so let's move on to question 2. What are the greatest obstacles to the adoption of patient-centered care and communication models, and how might the challenges be overcome? Pam.
So I will try and make this quick, but I'd just like to take a quick show of hands. How many of you think you are really good at communicating with others? How many of you think your colleagues are? Well, that's the problem in terms of adapting it. We do have this issue related to buy-in. A lot of us think we don't need this, so what good is it to present it? There also are issues related to cost. There's also certainly issues related to time. We talked a lot about the culture and how so many of us went into healthcare, or physicians went into medicine because they really wanted that relationship with patients. And somehow we've lost that along the way. And if we can figure out somehow to get this buy-in back, and also can figure out how we can increasingly develop closer relationships with patients, I think we're going to see some of the data that's referred to in the first question go up.
Okay.
Dr. Rathor, do you want to add?
We actually did a survey when we were, before we started the testing, and we asked the physicians, what did they think, how good a communicator they were, and they always gave them very high scores. And when they asked them about their colleagues, the scores were not that high. So I think, that's something, we need to keep in mind, that we may think we are very good, but we may not necessarily be that good, and others have a better perspective on it.
One of the themes I'm also hoping that we're grabbing hold of is that it really is the key to drive safety. And I think you're going to have a leadership team that is going to be really hard to really argue against you that you're doing this work to really create that safe environment, that psychological safety. So tie it beyond patient experience, tie it beyond satisfaction scores, tie it to really, it is the key to really creating safety. Just some ideas of how you might be able to have these conversations in a different way than you may have thought about them in the past. Question 3. Question 3 is best ideas, strategies for improving communication, models, solutions, training techniques, etc. What have you tried? What else has worked? What have you found very effective? What can we share with the group?
Ours fell down. So, yeah, I got it. So we had a host of ideas for this question, Andrea and myself, and some unique ideas, some stuff that you've probably heard. Provider learning boards was a theme so people can get instant feedback and actually feedback themselves. So they set their own objectives for learning and then see how they're doing. That was one of them. The other one was an example of handoffs that are used in a provider sort of environment. In the lab, they have a lab log where there's an ongoing communication tool to prevent errors from shift to shift. People were stressing the need for ambassadors, mentors, and coaching. And there's another theme with role modeling, I think further down the line. So as a great way to keep this instilled in the culture of your environment. We mentioned the checklist, SBAR, and then the one thing that we were struggling with, and there were some good suggestions, is mass communication. This is just really getting a message out to your whole organization. And we're talking about portals and using social media tools. The Navy particularly were strong on the use of simulation, and we concurred at Mayo that that's a wonderful way to take put people out of their environment and create a safe environment to get them coached or trained. The majority of people did say they were already doing huddles. There was some discussion about accountability and in a learner-centered way. And then tracking your data with surveys was important.
Then also we had on the theme of empathy, walking
They won't be able
in
to hear you.
patient's shoes.
They want that.
So another recommendation was walking a mile in the patient's shoes, so that empathy part, that really active listening to the patient. We mentioned social media as well. Walk-arounds to include the patient's family, so that whole concept of not just the patient, but including the family. Some have patient safety committees that includes the patient, so the patient is sitting on a committee and is a voice. In addition to, we mentioned role modeling, coaching, that was a reoccurring theme. Executive rounds and leadership care checks, where actually the leadership goes out and visits with the patient independently. And one individual mentioned a scoring system where, you see exactly during a week how many visits or how many times you got out for the leadership care checks. And of course, when you see yourself looking at, below the bar, so to speak, that motivates the individual to get out there. And that actually does make a difference in terms of reaching out and having those communication with the patient. So that's all we had as input.
Just to be clear, with those leadership rounds, this is St. Vincent's, their leadership's actually rounding on the patient by themselves, having a conversation, which I thought was very unique and worthwhile considering for everyone. We do safety rounds where everyone gets together and talks about things, but this is where leadership actually is rounding, and they're getting scored on how many patients they see per week. Very innovative.
Any other comments, thoughts? Okay, we'll go to group 4, and that had to do with some reflections from the people teaching this in terms of what they've seen in terms of culture change in their organization. Jamie.
Thank you. I'll try to be brief. I know we're running behind. What we have up here, a lot of our people in our group wanted to address some obstacles, which I'll tie in a minute. But to answer the actual question, what cultural changes have you witnessed at your institution from the individual to the organizational level with this initiative? And I think the biggest thing about that from my perspective is individually you have to have instructors that believe in it and are passionate about it. And then, because anecdotally, I have become a better clinician since taking this course. I implemented my practice, I have better patient satisfaction scores, I have personal satisfaction. Because of that, as my role as president of the medical staff, that we talk about the ripple effect from Dr. Maples and Terry, that we want this to grow. Healthcare is not just your hospital, it's everywhere. So I was so passionate about it, I presented it at the ECOM's Joint Commission meeting in Chicago 2012, and because of that, other presidents of medical staffs at various MTFs, military treatment facilities, at other institutions contacted me, and our facilitators went up there in a fiscally responsible way to teach their entire staff. For instance, Naval Hospital Charleston, in one day, we trained 60 individuals, allied health, everyone, and it was so favorably received that they are starting and actually going to be inquiring about possibly going into Asheville and becoming facilitators themselves. So that answers and the best I can in this question. Things we brought up as far as obstacles is the best way to sustain it and comply is tying it to peer review, sustaining it in peer review, make sure people are, what are your communication scores on your satisfaction, your credentialing, tied to your privileging. And I know Mayo had thought about doing that or is continuing to do that at one point. Also, people brought in about leveraging technology. In this technological age, we communicate various ways. You can be more efficient using Skype. I know there's some HIPAA compliance and stuff with that, but using your technology to the best of your communication ability and make your clinic more efficient. We also talked about the problem with obstacles is metrics, and we need dynamic metrics. How was this favorably received? How was this provider communicated well? And then giving that active feedback to those providers, it's going to make more sense and it's going to drive the point home that maybe you're not communicating as well as you think you are or should.
Thanks, Jamie. Any feedback to the group 4? If not, I think we have, some of you have done this already. I want to, first of all, it's time to get our lunch, which we got 15 minutes to get the lunch and back to the chairs to start the afternoon session. But before we do that, I wanted to thank the entire panel of 8 here for their tremendous work.